Yes, copy one then with that. I like it.
Mm. Yes, my people, welcome to Signature TV Films YouTube. Uh, Today, I invited someone from Masaka uh, to help clarify and address the issues concerning the COVID-19 fears in the country. He's a young doctor, someone who is very inspiring. He's a friend to me, and he's also a young guy. So, ladies and gentlemen, we are going to invite him, and we'll discuss much more about the issue concerning the COVID-19 fears in the country. All right, I think I have to put him on TV right now. Let me call him a little bit. Hello, Clifton.
Yes, I can hear you well.
Nice. How are you?
I'm okay. How you doing?
Great. How is
Wow.
Masaka?
Uh, Masaka is quite well. There was some panic some time back, but people
Mhm.
seems to be calm now. Yeah,
All right.
people are
I
a little
had
bit calm now.
on news. I had there's some Kampala businessman who died who committed suicide today.
Oh,
Did you hear about
I didn't.
that?
Oh no, I didn't really hear about that today.
Okay.
Mm.
Anyways, how is the going in Masaka, and how is the situation generally?
The situation, like I said, a little bit. People are a little bit calm now because when the thing just started about 3 weeks ago, there was a lot of panic. People moving, and people were wondering if really they're going to maybe abide by and follow the government rules. It was looking a little hard for people, but people are getting to adjust, and life seems to go on.
Wow, wow, wow.
Yeah.
That's really great.
Mm.
That's really great to hear that. So, like, assuming the condition of livelihood, how is it? The condition of livelihood, as you are a medical personnel, medical doctor, the condition of livelihood, how is it?
I think livelihood will definitely go on well because
Mm,
human beings have a very great ability to adapt to, let's say,
mm,
situations. So of course, at
mm,
the initial state, life might look to be a little bit hard, but
mm.
I think God gave us an ability to adjust to so many things. Sometimes we underestimate our ability to
True,
cope up
true,
with hard situation, but definitely we do cope with them. Yeah,
true,
so
true.
I'm really impressed. I'm
Have
impressed.
you, as a layman, have you ever tried to move around Masaka and find out how people are? Like me, I've been moving around Gulu town, and I've seen the situation. It seems not so much. So it's not like painful to the natives down here. Like the people are not so much coping up as see. Like some are even missing food because some of their parts like assuming the what how do you call it, border riders. At times they don't have even money at the end of the day, so at times they miss food. Is that the same case down there?
I think that's a general problem. It's cutting across the country. At
Mm,
least for the times I've been in Masaka, I've tried to move
mm,
around some villages, some areas which are a little bit remote, and you really see that people look at this as a very big challenge because
mm,
ideally getting what to eat is becoming a very big problem. And
mm,
as you well know, the government has tried to come in to make some intervention to give out food, but we haven't seen it in Masaka around time. So
mm,
people are really worried, but slowly they're busy. They're trying to catch up because at least, unlike people who stay in town in the village, at least you can be able to stretch in your backyard garden and get something at the end of it. Yeah, but for
definitely.
the street hustlers, like
Mm,
yes, for the street hustlers like those who are surviving with border borders, people who are
mm,
making chapati, it's really a very
mm,
big blow to them. It's really a very big blow to them. But at the end of it, we're all looking at the betterment of our country, And if
That's
we do
true.
away with the
That's true.
virus, then they'll be able to get back. Yeah,
True. Yeah, we must
yeah,
appreciate the president for what he has done ever since this pandemic hit the country. He has been so good to the region, to the nation generally. He has been guiding
definitely.
people, and also I have to appreciate the countrymen that have been following the guidelines really appropriately. So back to our burning issue, as we're going to be addressing the COVID-19 fears. May you tell us the facts about COVID-19? Because I think most times people have just heard about washing hands, social distancing, and the rest. May you just give us more facts about the COVID-19?
Oh, thank you so much, Oscar, for that wonderful guidance. I think I will
Mm,
need to first by defining what COVID-19 is.
true.
You see, I appreciate there's already some information that the community know about COVID-19, but still,
Mm,
I would like just to give a very small highlight on what COVID-19 is.
mm,
Most times people ask me, what's the difference between COVID-19 and coronavirus?
mm.
Maybe I need to
Yeah.
start from there. Yeah. So COVID-19, actually, let's say
Mm,
coronavirus is
mm,
it's actually a very old virus which has been in existence.
mm,
Uh, it's a very large family of viruses that are responsible for signs and symptoms simple as flu, cough, to even severe cases that to do with respiratory distress. Now, COVID-19 is just a strain in the family of coronavirus. Now, earlier on, we have seen already in the world, if you read very well our history, we already had coronavirus. One of them was the SARS, the severe acute respiratory syndrome, that so far we already have it in history. And then we also have the MERS, the Middle East respiratory syndrome. These are part of the corona family that already the world has seen them before. But the COVID-19 is actually a strain that it hadn't been known. So it was actually discovered in 2019. So the word COVID-19 comes from coronavirus disease of 2019. So that is how the name comes about. So it's a viral infection, as we all well know. As we said, it
mm,
belongs to the coronavirus family,
mm,
and it was
mm.
first discovered in Wuhan, in China, a city of about 60 million people.
Wow.
So that is briefly what people need to know about coronavirus.
Wow,
Yeah.
wow. Thank you very much for that brief info and the fact about it. May you tell us a little statistics? I've taken long today. I did not check out my computer, but is there any new statistics running out today?
Okay. Maybe before I give the statistics, because apparently it's very important for the world to know how other
Mm,
countries and other parts of the world is faring. But
mm,
after defining what COVID-19 is, many people would want to know how is COVID-19 spread. Maybe
mm,
before I give you the statistics, uh, there is only one. There's only, you know, before I say that, one thing I've learned about COVID-19 is that the rumors and the misinformation has actually gone more viral than the virus itself, and
mm,
that has really caused a lot of panic because people have a lot of mixed ideas about COVID-19. But
mm.
what is known so far is that its main way of spread is, of course, we can have transmission from human to human, and
Yeah, yeah.
research has also shown that there has been evidence of transmission from animals to human. So the most important thing that we need to focus on is the transmission from human to human. As we've seen that it mainly spread through respiratory uh, secretions, like when you
Mm-hmm.
sneeze or when you cough, that fluid that comes out of you really has a lot of virus in it. So when someone coughs near you, or sneezes near you, and then maybe the sneezes lands on the surface, and then you also come later on and touch, and
Mm,
then you maybe the reason why they're telling us don't touch your mouth, don't touch your eyes, don't touch your ears, your nose, is because in our mouth and the ears and the nose we have what they call soft linings, or the soft mucosal linings. So
mm.
if the virus gets to land in some of those surfaces, it's very easy for it to penetrate your skin and then to cause you a disease. So that is
Wow.
its mode of transmission.
Yeah, yeah,
Some time
definitely.
back there was a lot of rumors. People were saying it's airborne, but so far there's no evidence. There's no evidence
Mm,
that it's airborne.
mm,
All that is known so far is that it can come through secretions.
true.
About the world statistics, what we need to understand is that it's a very big problem right now. the reason why we call it pandemic, it's because it's been able to cross many borders, many international
Sure.
borders actually.
Yes, I
And
wanted to ask. Also, may I wanted to ask you the reason why it was called pandemic. But go ahead. Just tell us the reason.
yeah, so it's something. If a disease comes pandemic, it means it has been able to cross international borders, and most likely it has gone beyond one continent. And almost every continent now has it. So something pandemic is gone beyond different international borders, and almost every continent on the earth so far has it. So we realize that currently the world statistics, it shows that we have so far about 2.3 million people confirmed cases of COVID-19. And then so far we have about 160,000 confirmed death cases from COVID-19. It's quite a huge number. This is a global picture,
Very. It's a
and
global. That's
really,
much.
really
Yeah.
big. That's a lot. And the good thing also, there's some recoveries. We have about 555,000 recoveries. This is a good
Shout
sign
out
of
to
it.
yeah. Thanks to the doctors and the nurses doing
Yeah,
that work. Yeah.
definitely, definitely. Then we want to know, like, among the 2.3 million people, we need to understand which country bears the most burden, and then we shall later on narrow it down to Africa. So you realize that currently the United States of America so far has the highest number. When
Why?
this virus
Why?
started,
Just a question. Why is United States at the peak? I don't know. I don't know because literally, as a layman down from Golo here, I might be like, America has the most sophisticated, how do you call it, technical technicians, as meaning doctors, right? Technicians like doctors. You get who can
yes,
really
yes.
handle these cases really, really fast and really neat. Why is the United States at the peak?
Thank you so much, Oscar, for that wonderful question.
Mm,
As we all need to understand is that when it comes to epidemic control diseases, there are several factors that would lead to, let's say, a high number of death cases in a country, and that can be explained by a number of factors ranging from, let's say, the leadership, to do things to do with environmental, biological factors that's affecting the country. It's demographic as well. For the United States, many people have seen so much literature online. People are saying actually there has been a mismanagement of this pandemic. People are saying there was a lot of delays by the Trump administration.
okay.
But I really don't want to go into that so much because, like I
Sure,
said, there are
sure.
several factors that really would really lead to a number of death cases.
Yeah, but
For example,
I
we see
think
that.
what I've heard from you, the main one is mismanagement, right? Mismanagement.
Yes,
That's it. All right. I think
exactly,
you
exactly.
go ahead. Go ahead.
Yeah, so you see that the United States is currently leading, followed by Spain. Spain has about 195,000 confirmed cases, with a death of about 20,000 people have died of it. And in the USA, in the United States, there are about 39,000 death cases. Now that gives
Oh,
us, then following that, we have Italy. Sometime back, Italy was leading, but somehow they were able to curb down the infection.
okay.
And they also stand at around 175,000 cases. Now, what we need to understand from these figures is that what do we need to appreciate and understand from it? Now, what we need to get from these figures is that if we have, let's say, for United States, 740,000 people confirmed and 39,000 death cases. Now, that those figures helps us to appreciate what they call the mortality rate. Now, the mortality rate simply means what are the chances if you have, let's say, 100 people infected with the disease, and then out of the 100, if let's say 10 of them die or one person dies, you're able to calculate the mortality rate. So you realize that that's the likelihood of someone dying from a disease. And so far, we have seen the United States is sitting at about 5.2%, meaning the likelihood that someone will die from the disease is at that. And
Oh,
then
okay.
I would also want to tap something small on Africa. We realize that in Africa, okay, we also have a big burden as well. Although if you compare Africa to other continents, you realize that we don't really have much cases like them. So in Africa, I think currently South Africa leading with about 3,000 cases, with about 903 deaths. That's quite a huge number as well. And then we followed by Egypt and then maybe you come to Rwanda in East Africa. I think
Mm.
Rwanda is so far the leading, and then Kenya is also at the same level
Okay.
with Rwanda. But so far, we don't really have much death cases in East Africa. Realize that in Africa, it's mainly North Africa, which is bearing the biggest burden, maybe because of proximity to the Europe and
Now,
other
talking
factors.
about proximity to
Yeah.
Europe and other factors, later, early this morning, I was talking to one of a friend in Golo here, and he was telling me one of the
Yes.
factors which is leading to the fastest spread of the disease in the Europe is because of the weather. Is weather related to the virus?
Thank you so much, Oscar. That's a very nice question, and because when of course a virus it has a lot to do with the weather condition, especially temperature. You realize that
Mm.
it has shown much survival skills for a virus. It's really very high when it's a low temperature because
Mm.
it's basically made up of protein molecules. So it means very high temperature will be able to denature its structure. So it makes it render actually to die. So of course there's relationship between weather because the cooler the weather, the more it survives, and the harsh or the higher the temperature, it, it normally dies out. So
Yeah,
there must be some relation.
I think it
There
should
is.
not be like of an advantage to us because a virus is a virus. It can kill anybody. You get, no matter where you're from or the weather. So everybody should take precautions, and we should avoid have that. Uh, get the advice from the president. Social distancing is a must, and the rest of the stuff. Right?
I agree with you 100%.
Yeah,
I agree with
definitely.
you.
Yeah,
People need to follow it.
the
It's at the end of
guidelines.
it, it's still a virus, and then anything can happen.
True.
Yes.
Mm.
So I also wanted to ask to looking at the mortality rate. You've seen that Italy, for example, Spain, uh, China. Now there is something we need to learn from these numbers of deaths, and something that Africa needs really to prepare. Now, when you come to Italy, realize that Italy is the second oldest nation in the world. It has about 29 to 30% of its population are elderly, meaning they're about 65 years of age. So you realize that that takes us to who is at risk of COVID-19 disease. You realize that, of course, everyone is at risk of contracting COVID-19, but there is a particular population of people that when they get the virus, um, it has a chance of progressing into a severe form, and that can later on it can lead to death of people. So realize that Italy predominantly, because of that, the majority of people who died from Italy are actually elderly.
Mm.
So that was one of the factors. That's why we had a very high number of deaths in Italy, simply because it has a very high, actually very old population. Now,
Mm.
narrowing it to Africa, what we need to really worry about, as for us African, we are the youngest continent in the world. So things to do with age may not be our risk. Now, what we need to come to Africa is things that will predispose us to more number of death cases are things to do with malnutrition, because malnutrition is a very big problem in Africa, um, followed by the burden of HIV. You realize that these are people who fall under the category with like the immune system actually has gone low. So when the virus comes to you, your chance of surviving actually reduces. So as Africans, we need really to be worried about malnutrition and HIV. That could be our biggest challenge as we prepare for
Okay.
COVID-19.
Yes. Thank you very much for addressing such a statistic. It has I've really understood the statistic really well from you. But my next question might sound so political, but I think you just have to narrow it down a little bit to bring people's understanding to on point. I want to find out how is the health workers condition? How is the health workers condition in your area yeah, of Masaka.
Okay, thank you so much for that. I think that has been one of the biggest question that has been in context for a while,
Mm,
and it's one of the most controversial things that people really need to understand.
mm,
Um, if I may say, the government is following a national protocol, and
mm,
as you can see, all regional referrals, if I may say, have been equipped to handle COVID-19.
Mm.
But of course, it's not to the best as we see other developed countries, because apparently countrywide we have about about 12 ICUs in
Mm.
the country,
Mm.
and most of them are concentrated around Kampala. And then you realize that we have
Okay.
about 55 ICU beds
Mm-hmm.
in our
Mm.
country, and and of course, a functional ICU means a functional, meaning a professional who is able to attend to them, either an expert nurse or someone who has been trained on emergency care and critical care.
Mm.
And this also stands as a very big problem. So, generally, as a country,
Mm-hmm.
I can't say we are really fully prepared, because
Mm.
looking at those statistics, you realize that it's actually a very big threat to our country.
Wow.
But at least regional referrals have been given the basics of, let's say, PPI, the personal protective gears, and they've been able to establish isolation centers within them. So apparently, in terms of equipment, I think we still have a big problem,
Big
although
problem.
um, yeah, it's still a big problem. Now, coming to the health workers, uh, let's say, capability or orientation to handle COVID-19. Like
Mm.
I've said, uh, what the government is relying on right now is the regional referrals. So you realize that every region has, if for example let's say you are in Pabo, and then
Mm.
you
Bubble.
have a suspect that you really want to handle. You
Mm-hmm.
realize that our health centers, from ranging from center 2 to center 4, don't have capacity. So the best they can do is to simply be able to identify a case or a suspect. And when they identify a suspect, they don't have the mandate to handle, but rather to call Ministry of Health, the district task force. And then that person is, the Ministry of Health, the district task force is able to come and evacuate him, and
Mm.
then he's taken to the regional referral. So
Okay.
that's how the protocol is working. We realize
Mm-hmm.
that the lower facilities don't have capacity.
Mm.
You simply identify and then you refer to the regional referral.
Okay. Wow, that's really good. That's really good of you. Yeah. So, assuming, let us talk about this scenario which took place like 2 or 3 days back in Golo. Was that really called for? Was that situation really called for? Like the patient was taken back to Kampala. Was that really called for? Couldn't the referral of Gulu handle it?
Um, I think that was quite a complex issue, because at the end
Mm.
of it, we saw two things coming in play. We have seen the technical team, or the Ministry of Health National Task Force, gave a
Mm.
directive that was
Mm.
intercepted by, let's say, the political leaders. I
Mm.
must say there have been, on either ways, there's been faults in what
Mm.
happened.
Mm-hmm.
Maybe I want to start with what the ministry did, because ideally, when it comes to infection
Mm.
control, the protocol really necessitates that the best thing we need to do is to break the
True.
transmission chain. And breaking transmission chain is that it means we have to remove every chance of someone getting the infection or the infection going
Mm.
beyond. So the fact that the truck drivers were being tested from Malaba or the borders or Motukula and being set
Mm.
free without getting results, it makes it a little bit hard, because you won't be able to contain transmission in case someone is positive and is going to mingle with the community. That was really bad.
Mm.
And then on the other hand, also I think there was a lot of bravery by the local leadership of the region.
Mm. Mm.
But ideally, I would think in such a time like this, I would really prefer that we let the technical team be in lead, because at the end of it, we have a responsibility to save lives regardless, and all regional referrals have the same mandate to save lives of people. You've
Yes.
seen positive
Uh,
patients,
yes.
you've seen
Thank you. Thank.
positive patients being handled.
No, go
Okay,
ahead.
okay.
Go ahead. Go ahead. Go ahead.
Yeah, what I was saying is that we've seen other referrals as well being able to handle, like a Germany and Hoima. So in the
Mm.
same respect, I expected if Golo referral wasn't in position, I expected probably the technical team to come out and maybe say this. But at the end of it, I feel like at this time we really need more technical guidance than politics.
True. Thank you, Clifton.
Yeah.
My last question to you is the post COVID-19. the prevention strategies, assuming the president lifts the bans which he has put to safeguard the nation. What are the post COVID-19 prevention strategies that you as a medical person would advise?
Thank you so much, Oscar. We really hope one day they'll lift down this ban because,
Definitely.
as we all know,
The
in
by
epidemic
the way,
control,
by the way, the president has an address today. I think he might lift the ban anyway.
we don't know. We're not really sure. We might get
Yeah.
some good news though. But
Okay.
as far as I know, when it comes to epidemic control, we must be sure that the curve has been flattened and it has really gone down before we remove any measures that has been in place. But all in all,
So
as we continue with this
meaning
lockdown,
we still have the curve like trying to grow. I remember him showing us the curve last time on TV. The curve, is it still growing or is still sloping a little bit?
as I can say, you realize that the number of cases have really gone down. I mean, like the number of new cases, the trend at which we are getting number of new cases has really slowed down. So, in an explanation or in analyzing epidemic graph, that could probably mean we are about to reach our peak, or maybe we are actually already there. So the fact that we can go for days without getting any confirmed case, uh, it can be explained that we're probably already on our peak, or we're about to get to our peak. Yes.
Wow. All
Yeah.
right, get to my question. Thanks.
But yeah, get to your question. So what we need to understand is that um, COVID-19 is real. It's actually taking out people. As we said, the most vulnerable people in Africa, we need to protect them. The elderly people, the HIV positive, with hypertension, they're really at risk. So what we need to do is that the first thing first, um, we need to wash our hands. Like the protocol is saying, wash your hands because soap has a very great impact on the virus. It's able to destroy it. So when you wash your hands, you'll be keeping yourself safe. And then at most, if you're not able, please try to use some sanitizer. You see, I have mine.
Sanitizer.
You can be able
Wow,
to,
wow.
yeah. Alcohol also has the same effect, but don't drink it.
Yeah. There was a time. There
Yeah,
was a
yeah,
time I was moving. I
yeah,
was moving in the
yeah.
market with the district task force, and they're complaining. People in the
Mm,
village are drinking sanitizers. Can that have an
mm.
effect in their body?
Of course, sanitizer has some level of alcohol in it, but at the same time, it has some other components. So it's not really good for human consumption. Like let's say you take it inside you, but it's mainly for external use. It can cause some destruction as well. Yeah, so
Yes.
we need to keep
Okay.
ourselves clean.
Before
So we
you go
clean
further,
ourselves.
before you go further, let me just ask you a question. You have talked of hand washing.
Yes.
All right. Now, how will a village person manage, okay, and continuously wash his hands after the pandemic? And putting in mind that right now they are just being forced. You get most of the people in the villages are just being forced to wash their hands. And how will it be? How will the situation be like afterwards?
Oh, thank you so much. This is it's a behavior. The society has a lot of. When you want to handle such a situation, we need to learn the people's behavior and character, and we as well know that in the rural communities that has not been the practice. So I think the most important thing is now. This is now where we need our leaders more to come and really keep on sensitizing the people, the community at grassroots, that to realize that it's a very important practice that we need to continue with, because not until we are declared to be COVID-19 free, that is when maybe probably people might need to stop. But for the meantime, I really encourage the local leadership from LOC1 to chairpersons to councillors and to the MPs. I think this is where we need them most to keep on
True,
sensitizing
true.
the community on how best they can keep on with some of these practices. And because it's really powerful, it's powerful because we don't know when a vaccine will come yet,
True,
because we have
true.
seen other countries doing attempting to have trials, but the standard is we know a vaccine takes a minimum of 12 months for it
12
for
months.
any of them to be tried. So if we are lucky, maybe it will come by around December. So the
Oh,
biggest weapon we have right now is wash our hands and do social
social distance.
distancing.
Wow.
Yes.
All right, get straight to the next point you wanted to give us.
Yeah. So I was still telling you. Then the last thing that we need to do is, if you have a loved one, a relative, a brother or a sister that you feel like possibly could have the signs and symptoms of COVID-19. Oscar, I really wanted to address a little bit on the signs and symptoms of COVID-19.
Mm.
As you realize that most of the signs and symptoms they're saying are quite more common with, let's say, the malaria that people have been having, the cough that people have been having. So in some cases, we've seen earlier on, health workers were actually fearing to handle patients because of the signs and symptoms, which look a little bit unspecific. Now, this is what we need to know, that COVID-19, yes, the first thing it has is fever. That is about temperature, which is about 37.5 and above.
Uh-huh.
If you have that persistent temperature, which is high, which is not responding, let's say to Panadol or any other pain reliever, that could give me a sign that probably something you need to check yourself up. And then the second sign and symptom is the cough. Now, the cough of COVID-19 is actually dry cough. So if you have uh, productive cough that you are able to spit, that is not COVID-19. And the cough must at least stay for more than 5 days. And then the last thing is the difficulty in breathing. Most time, the difficulty in breathing should be able to, let's say, to persist for about also 5 days. In the event that you can't breathe on your own and you need support. Now, these are the signs and symptoms we are talking about. So if yours has not progressed to this extent, you might
Mm.
just have some regular infection and you don't need really to worry. I've seen many
True.
people really worried. Someone gets cough today and it's like, oh, I think I have this thing.
Already.
Yeah. So, yeah. So, and that is the same basis when you come to the health centers. We've
Mm.
been trying to do a lot of, let's say, continuous medical education in some of the facilities I was able to visit. We are trying to reorient health workers on how to handle suspects. Because you realize that today, someone may walk to, let's say, Bible Health Center 3, and
Mhm.
then the health worker there will simply see someone with cough and temperature, and then will be tempted to abandon them. So realize that a suspect should be someone who has given the signs and symptoms that I've explained, and which have been able to persist for the number of days that I've mentioned. So if you have a client who has just experienced fever for 1 day, 2 days, and the cough is not as serious, no difficulty in breathing, you have to first do your part as a medical worker to rule out other infections like malaria and simple infection before you proceed to think that someone has
Mm.
COVID-19. So we really have to, our health workers really need to get the confidence so that we can handle these people. And I think
True.
at this point, I would also like to call upon our leadership through the district health officers that our health workers down there to the center twos and center threes actually need to be reoriented because without that, we really need to build on their confidence. They've already made enough sacrifice for us, but at
True.
the end of it,
Mm.
they also deserve to get the right facts and knowledge so that they'll be able to handle our patients.
True.
Yes,
Yes, Clifton. I think your last. We are running out of
yes.
time. We are running out of time. So your last words to the people viewing and yeah, the people viewing. The last one.
Oh, thank you so much, Oscar, for this chance, for making me have some chance to engage the community. My last word to people is that one thing that we need to protect ourselves from is there has been a lot of mental, let's say psychological stress that has been brought to people due to COVID-19, the fear of getting sick, the fear of dying. I think people need to understand that we need to protect our health. We need to protect our mental health from these
Mm-hmm.
fears. And how do we do that? One, we need to rely on information from the right sources. There's a
True.
lot of things on internet, a lot of internet words. Not everything on internet is right. Try
Like
to look for
last
authentic sources. I would advise if you're in Uganda.
some days back, I watched on TV. There was some Ugandan scientist who was like he developed a vaccine for the COVID-19. Did you have a glance on that?
Yeah, I was able to see that, but my brother,
Yeah.
I think that gentleman probably could be having an idea on what he's doing, but I think the approach was really wrong because we don't really
Mm.
defend scientific research on YouTube. You have to
Mm, yeah,
follow
yeah.
the basic protocol. Yeah.
Definitely, yeah. Yes, give us go
Yeah.
ahead with your last words. Go ahead.
Yeah, so I was trying to address that we need to limit the information that we get on let's say on social media. and we need to rely on like authentic sources. If you're in the country, at least I would recommend we need to wait for Ministry of Health or the minister herself. Oh, if you're reading things all over internet, we might want to rely on CDC information or WHO, and then maybe John Hopkins, because it's one of the is a center that we're relying on its data worldwide. So we need to protect our minds, and people shouldn't underestimate their ability to cope up with hard situations. That I can assure you, we have the ability.
True,
Yeah.
true, true.
Abbas, thank you so much for this wonderful opportunity.
Yeah, yeah. Really, I'm really thankful. May you tell us in actually, assuming someone maybe wants a conclusion part in actually, just maybe give us some little summary in actually.
Thank you so much. Lutwa, ana foyo ba, unjo ma obedo kanami discussion mo beri yema tirini. Wan mo beri kom kalo kom COVID-19, mana yetuo mako beti noni, tika kela yela, dano tiki luoro, andano betika toye. So mapira tek ye ko beri nimero wan mo bero kigan, mo bero ma watiki information mati, ma aki kamatu mo pore. Ko beri ni tuo no wano nano tie Uganda ko beri cases dong mawati confirm ti chaka yedong PR beach we a beach actually PR beach we a beach so ma PR teki wan me robero gono ka wenyo cheke pa makamente po manga mente ti kamini wa mete wono kilwa ko ching PR tek kan lwa ko ching ki jabon nyo kenani mun jo kene ma ol jeba wutie te ki care ma welo sanitizer dun bene ma dek social distancing PR tek gamenta ko bero kate ki chek ni wan dan pa mero bed mano ke gora ka chen bed mano at least meta ti ariyo mapoke kenwo ini penny kono gamenta ti ka yelo wanono ko research ko bero nyoro ni tuo ini kobo ikom dano ke gano so inoni ka ini bero bo ke ngat matiki tuo ni bimi ni kero me gwake gwaka tuo ni pe mari idong na madek ke nen gwak pitiki ngato mo me nen tika nyoro signs and symptoms matika ona lierti matek mapera tek ni one pamir was stigmatizing ngat matiki signs and symptoms mapera tek yo mero miyo yere kony ana ye kony mateni obelni district weng tiki national task force mamegi district task force and numbers team waramo go chimi ye we kwa no wono kony alego ni dano mero bet ka chel ki bet maki gwake po was stigmatizing wono dano ba mapera tek mamiyo wono kony ki dano so again an lok mo maduong manaro wa ne ko beni pe again ko be down tika wenye check because information ko be de tiyo rama ping ti wano mete wono ki wenye check pagamente kare menen ko be miyo ni be bitum ti ba be dak wono business mo mego machon afoy wono matek ba be wono gwake ba be wono gang ba lwa wono chingwa foy wono
Yes. Clifton, a foil message made me okay down wing, yeah. So yes, that is that. Thanks for your time, and God bless you.
thank
I
you
think
so much Oscar
when
God
are you
bless you too
visiting?
man
When are you visiting Gulu?
I'm still don't know because I'm a part of the team here so until this thing is
Oh,
calmed
you're
down
in the
that's when I'll
you're
probably be able to
you're
get some time and come
you're in the district task force, is it?
definitely I'm part of it
Wow, that's so good of you of representing the region to another region.
definitely
Yeah, I had.
okay
Thanks a lot for your time. I think the next time we plan another interview like this, I think it'll be much better, guys. This was our first time. I would like to appreciate everybody who has been watching. Let me just give a little shout out to everybody. There is Kinyera Afoyo, Regino. Thank you very much for your comment. Felix, you've been with us from start to the end. Thank you, Felix. We have Anthony Simon. Thank you very much for your comment. God bless you. Then also we have Felix again. Felix has been so good with us. Has been like from start till the end right now. Let me see Anthony again. Then again Felix. Oh, you guys have been so good. Then Modern Generation Media. Yes, thank you very much for your support too. Because we have to move forward. That's true, and we have to showcase our region to the world. That's it. It has been a wrap, ladies and gentlemen. Hope you have had really, really a good time with me and Clifton I would like to say God bless you guys. Guys, follow the guidelines the government has given so I will combat this pandemic. That's it.